Backpacks are a necessary tool for students to carry around school. But the weight of the backpacks has a long-term effect on students' posture that may be causing arthritis and even headaches. Reporter Jamie Perez went to the health center on campus at California State University Northridge to get the full report.
Tanin Kademi has suffered from back pain multiple times as a student. She says carrying around a backpack is the main reason for her numerous doctor's visits.
A lot of doctors, I've seen a lot of chiropractors, and then because I used to have like low back pain every day.
Kademi says she's had to switch over to using a rolling backpack to relieve the stress off her lower back.
Because I could feel like tension on my shoulder and my back, so I decided not to carry backpack anymore, and then having the rolling backpack that could keep my back straight and then take the tension off my back and shoulder and give me relief of not having a low back pain.
Dr. Robert Patterson says students who carry heavy backpacks suffer from several health issues.
Well, it leads to headaches, neck pain, shoulder pain, and back pain, which are the most common things that we see here, and we can relate to backpacks.
Dr. Patterson gives his patients stretching tips to reverse some of the damage done by carrying around too much weight.
Right wrist.
Okay.
It's common for students to carry backpacks that are too heavy for them. In fact, in 2015, 14% of college students reported being treated or diagnosed by a professional for chronic back pain. And that's not surprising considering textbooks can be pretty heavy.
Backpacks are a necessary component for any student, but carrying that weight on your back isn't mandatory. Some students switch to rolling backpacks to relieve the pressure off their back. Dr. Patterson says in addition to having a rolling backpack, staying in shape can also help.
Exercise, stretching, and just making sure they have good body mechanics when they move, when they go to bend to lift things. Ideally carrying a weight that's appropriate for them in the backpack.
The American Academy of Pediatrics recommends no more than 10 to 15% of a person's body weight to be carried in backpacks. And this may be difficult considering students carry books, laptops, lunch, water bottles, and other supplies every day. But if students take the necessary steps like getting more flexible and strengthening their backs, they can dodge some of these major problems.
Oftentimes the first course of care is to getting flexibility. Getting them stretching, getting flexibility. Then the second phase of it is strengthening.
As long as students only carry around what they absolutely need, they can avoid the detriments of putting too much pressure on their backs. In Northridge, I'm Jamie Perez, Valley View News.